A patient presents with the sudden onset of unilateral chest pain, followed almost immediately by respiratory distress. He is noted to have a blood pressure of 75/45 of a millimeter Hg, pulse of 130 beats min, and decreased breath sounds on the right side of his chest. What is the most appropriate initial step in the management of this patient? A. Administer intravenous antibiotics. B. Infuse a 2-L bolus of normal saline. C. Obtain a chest radiograph. D. Obtain an electrocardiogram. E. Perform a tube thoracostomy. Answer: E. Tension pneumothorax is a critical diagnosis that must be made and remedied, if present, in the first few moments of the rapid stabilization and assessment phase of any patient encounter. If a patient presents with chest pain, respiratory distress, shock, and unilateral reduction or absence of breath sounds, immediate intervention with needle or tube thoracostomy is required. A 65-year-old man with a past medical history of prostate cancer presents with chest pain. His blood pressure is 60/40ths of a millimeter Hg, and his pulse is 145 beats min. The ECG shows diffuse ST segment elevation, and cardiomegaly is seen on his chest radiograph. What is the most appropriate first step in the management of this patient? A. Administration of dobutamine. B. Administration of dopamine. C. Cardiac catheterization. D. Cardiac ultrasonography. E. Thrombolysis. Answer is D. Prompt bedside cardiac ultrasonography would be the most appropriate next step in the management of this patient, who presents with symptoms and signs of pericardial effusion with tamponade. If confirmed by ultrasonography, immediate pericardiocentesis would logically follow in an effort to reverse the signs of shock in this patient. Other signs that could accompany the presentation are low voltage on the ECG and elevated jugular venous pressure on examination. A tearing sensation is classically described for which of the following causes of chest pain? A. Aortic dissection. B. Coronary spasm. C. Esophageal rupture. D. Mollyway's tear. E. Pneumothorax. Answer is A. Tearing pain that may migrate from the front to back or back to front is classically described in aortic dissection. Descriptions such as squeezing, crushing, or pressure lead to the suspicion of a cardiac ischemic syndrome, although cardiac ischemia can be characterized by non-specific discomfort, such as bloating or indigestion. Sharp or stabbing pain is seen more in pulmonary and musculoskeletal diagnoses. Patients complaining of a burning or indigestion type of pain may initially be suspected of having a gastrointestinal cause. However, because of the visceral nature of chest pain, all causes of pain may present with any of the preceding descriptions. Uremia is a risk factor associated with which of the following causes of chest pain? A. Acute coronary syndrome. B. Aortic dissection. C. Pericarditis. D. Pneumothorax. E. Pulmonary embolism. Answer is C. Uremia is a risk factor for the development of pericarditis. Other risk factors associated with the development of pericarditis include infection, autoimmune disease, acute rheumatic fever, recent myocardial infarction or cardiac surgery, malignancy, radiation therapy to the mediastinum, and prior pericarditis. A narrow pulse pressure is more closely associated with which of the following diagnoses? A. Acute myocardial infarction. B. Aortic dissection. C. Pericarditis with effusion. D. Pneumothorax. E. Pulmonary embolism. Answer is C. A narrow pulse pressure is a pivotal finding in the diagnosis of pericarditis with associated pericardial effusion. Other characteristic, but less specific, potential findings in the patient with pericarditis include hypotension, tachycardia, fever, and jugular venous distension. The more specific finding of pericardial rub is also heard in some patients with pericarditis. The finding of Hammond's sign is most consistent with which of the following? A. Cholecystitis. B. Mediastinitis. C. Pericarditis. D. Pulmonary embolus. E. Unstable angina. Answer is B. Hammond's sign is an audible systolic crunch, heard on cardiac auscultation that is produced by the heart moving against air in the mediastinum. This can be heard in conditions such as esophageal rupture, mediastinitis, and pneumomediastinum.